Hey there, everyone. Welcome back to another episode of the Growth Room podcast, where we dive into all the facets of healthcare with experts who are leading the industry. Please join me in welcoming Kevin Coss, the Chief Wellness Officer at Community Health Network. Thank you so much, and we appreciate you for joining us, Kevin. Can you please tell us about yourself and what you do at Community Health?
Sure. It's a pleasure joining you today, Sal. I'm a practicing internist. I'm semi-retired now. I've got about 40 years of clinical practice in internal medicine. And throughout my career, I've held a variety of leadership positions, including group practice director. I've been on the hospital board. And most recently, I have been chief wellness officer for community physicians. And that's a group of about 1,600 employed physicians and advanced practice providers for which we support their well-being and professional development.
Super interesting. So, what is your workflow like? What's it like to be Kevin for a day?
Well, as a general internist in the ambulatory setting, most of our patients are older with multiple chronic problems, the majority of which are usually Medicare age. And so we focus a lot not only on chronic disease management, but also on preventive care. So typically, our days are usually filled with a variety of physical exams and then chronic care visits. Part of our biggest workflow is really the pre-visit planning, since many of these patients have multiple chronic conditions, they're on multiple medications. It involves evaluating multiple laboratory and diagnostic studies. So the pre-visit component of preparing for a visit is a major workflow issue for us.
So, how critical is technology in your day-to-day processes? What processes, tools, or tech do you rely on to perform optimally?
Well, certainly the electronic health record has provided a lot of efficiencies in terms of being able to access patient data in a timely fashion, particularly when we're trying to get information about hospitalization or discharge information, as long as it's within our network. One of the challenges is not all of our patients are always hospitalized within our hospital network. And in the community that I'm at, we have three major hospital systems, and they're all using different electronic health records. So interoperability is really challenging when you're dealing with patients that are visiting different facilities. The other tool that I personally found very helpful is using voice recognition for dictation. I personally do not have very good keyboarding skills, and so with the advent of electronic health record and data entry, speech recognition has been a huge benefit to many of our physicians. We now, using our current vendor, have probably of our 1,600 providers, we probably have over half of them using speech recognition in some fashion to help their documentation burden.
What kind of speech recognition software do you think works best for this type of scenario?
Well, we're using Dragon Medical One right now. That's the vendor that we have chosen, and the quality of speech recognition has improved remarkably over the last few years, and the training is very simple. And it really, you cannot document any faster than speech, no matter how good a typist you are. It's very difficult to beat speech recognition as a documentation tool. And now that it's improved with accuracy, it's really a great technical advance for us.
Interesting. So, what about the team you lead? What kind of challenges are they facing? And what type of technical solutions do you think would improve their overall performance or satisfaction?
Well, I think workflow has continued to be a major challenge in the outpatient setting, and unfortunately, with the electronic health record, it sort of dictates the workflow to some degree. And physicians have typically, prior to electronic health records, sort of devised their own workflow that works for them. And when you now, in the era of the electronic health record, there are certain workflows that you have to do or you run into some hard stops, which become very disruptive and distracting, and it doesn't necessarily always parallel the way a clinician might approach workflow in the office. And that has everything to do with how they check into the office, how our medical assistants place them in rooms and reconcile medications and update their chief complaint, and extending all the way to, refilling medications. And a big particular burden right now is prior authorizations for imaging or medications, which takes up a significant amount of time for not only physicians and other clinicians, but also our nursing staff, which probably deal with the burden more than we do. And with all the insurance regulations and issues regarding formulary coverage and different insurance companies with different benefits, it's overwhelming sometimes for both physicians and staff to try to accommodate what the patient is eligible for with what you think is their best therapy.
Why do you think it's so overwhelming? Why is the work for them so overwhelming? Is it because of the tools that they have, they're not adequate enough, or they're not being fulfilled with the usage of them while they're using it for their tasks? Why do you think it's causing such an overwhelmed type of feeling for people right now in healthcare?
Well, I think over time, especially, with not only commercial insurance, but with Medicare Advantage, which, as you know, has become a very popular option for many seniors because of the certainly cost benefits. Unfortunately, Medicare Advantage also has the most restrictive formulary and the most restrictive prior authorization process for imaging requests and referrals. And as we have tried to manage controlling the cost of healthcare, insurance companies are continuing to find ways to continue to restrict certain services. They put more requirements in place in particular for imaging. Formulary access has been more and more restricted because of the growth of new medications, particularly biologics, which are very expensive. So there are created many layers of criteria that you must meet. In other words, to be eligible for a particular medication or for particular imaging. And every insurer has different criteria that they may use arbitrarily to determine what the criteria the patient is going to have to meet to be eligible under their program. So you're dealing with a variety of different insurance carriers, all with different rules and regulations and administrative paths to get approvals. It's interesting, CMS requires the insurance companies and pharmacies now that deal with Medicare patients to audit their denial rate. And in 2021, I think there were 35 million prior authorizations required with Medicare Advantage. And they found that only 3% with Anthem and I think Humana were actually denied. And 85% of those denials were either, when reviewed or appealed, got partially or completely overturned. So I think that gives you an idea of what we're dealing with, is that the majority of things that physicians are ordering are clinically appropriate and reasonable. However, these are huge barriers for patients to receive their care and adding tremendous administrative burden on the backs of our office staff and our physicians. And the worst scenario is it's affecting the quality and the safety of their care because it delays patient care.
Yeah, it sounds like it's just becoming harder and harder to give care, right? Right. Even if you want to, because you have to follow certain protocols. And, hopefully I would say the past 10 years has definitely been a learning experience for everyone with the whole digital transformation thing, and the adoption of EHRs or EMRs from paperwork, right? But there's a new journey that's about to start called the AI transformation journey. It really can't be ignored because of the tremendous benefit that it could potentially have, to every role at a healthcare organization, what are your general thoughts about the next 4 or 5, maybe 10 years, about how healthcare might shape up as AI gets better and better and rolled out even further and further?
Well, I think everyone thinks healthcare is really the area in which AI may have the greatest impact. As you can see, the number of vendors and innovators in the AI space focusing on healthcare in particular. I like to think of it in three different buckets. I think AI, the three areas I think it will have the biggest impact, or you can break it out, will be research and development. So I think drug development, clinical trials, reviewing data in clinical trials, setting up clinical trials, discovering new molecules, bringing drugs to market quicker. I think that's a huge piece. I think the direct patient care piece, which is really the clinical aspect, helping with clinical decision making so that you can follow best practice guidelines easily, that can be integrated into the electronic health record to help guide you in terms of decision making. I think that's going to be huge. As I mentioned, I think that anything that we can do to reduce this low value work, which would be how can we use AI to help streamline prior authorizations, identify medication options in patients through their benefits and their formulary that make the most sense in terms of what's looking at cost, looking at availability, looking at best agent available. Right now, that's really sort of hunting and pecking. Trying to look at every individual patient's formulary, and you sort of throw a medication out and hope that it goes through. And if it doesn't, then you get a rejection, and then you have to start the whole process over again. So I think those areas in particularly would be quite helpful. I think it will definitely improve safety and quality. I think the challenge is, as long as it doesn't increase the administrative burden by adding extra work or disruption in the delivery of care and the care of the patient during the visit or after the visit.
Yeah, super interesting. In terms of just AI and the billing side, right? From what I've heard after speaking with people on the payer side, is that they're already starting to use AI to pretty much check the claims through their billing pipeline, and that creates all sort of nuances because of AI bias and
Exactly.
other AI related controls that not everybody might be aware of. And ultimately, I don't know how that's going to pan out. We have to see it yet, or it might already be happening. But do you think, now, if you're a physician, right, you're worried about your patient's health. Should you be worried about whether or not some AI in the cloud is going to accept your claim or not for the patient?
Oh, yeah, I think there are huge ethical issues there. Is there going to be misalignment between the business case and the clinical case for patient's care? And I think the problem with AI is we really don't understand how it comes up with decisions, right?
Yeah.
We have large language models, layers of these with neural networks, and it comes up with an answer, and we don't even understand how that process evolved and how that AI tool made that decision. So I'm very concerned. Most physicians and surveyed, those are the major concerns: are bias. Are we going to exacerbate current inequalities in healthcare? What about healthcare systems that can't afford AI tools? So are we going to have institutions that have the resources to take full advantage of some of these tools, and then we have smaller regional or rural hospitals who don't have those resources and can't afford to add these additional technology tools to their electronic health record, and their physicians and their patients aren't going to have access to them. So I think there are certainly a variety of concerns about how AI can augment rather than replace humans in that decision model, because medicine is still an art as much as as we, call ourselves scientists, there's still an art to medicine in terms of really personalizing care. And you have to take into consideration a variety of things in context when you make a decision about what you believe is in the best interest of the patient. And I'm not sure that AI is able to take in those complex context issues that hopefully a qualified physician who has longstanding relationship with the patient can take advantage of.
Interesting. How do you see a co-pilot for physicians, for admin staff, for nurses? How do you see a co-pilot playing out, an AI co-pilot where the physician can speak to the machine? How do you see that playing out over the next few years?
Well, I guess when I'm looking at the current functionality of AI, the things that I think we ought to be addressing first are the low-hanging fruit, the operational pieces, the things that I think are most easily automated, that can be best addressed without getting into very complex clinical decision making. That can be scheduling. That can be, like I mentioned, trying to find a way of streamlining patients getting their prescriptions and reconciling their formulary, prior authorizations, better communication with patients, helping them best understand maybe their laboratory testing and diagnostic imaging. One of the challenges we have today is because of the current regulatory environment that patients get all of their laboratory studies and their imaging studies, their results immediately. And that creates a huge burden for physicians because the patient, when you get let's say you get an MRI of your brain, as soon as that MRI report is available, you get a text alert on your phone that says your MRI report's available. So you see the entire report. And most patients are not in a position to really understand the context of that report and the details. So the challenge is that patients are often given information and not having an opportunity to sit down with their physician at the same time to really walk through that and understand, is this report, concerning? What's the implication of the report? So I think that that's a piece that could be potentially helped with AI, where that type of report could be summarized in a layperson's language with some additional comments regarding, follow-up and communication with your physician, so that patients can be reassured in many cases that maybe those findings don't seem as ominous as they appear in the context of the report, and also, help the physician coordinate that discussion. I think it's just very frustrating sometimes when, especially if it is a serious abnormality, that the physician has not had any time to prepare to discuss that with the patient, to help prepare that patient for that information and to help lead that discussion. It's very, very frightening for patients to get a pathology report about a cancer or a mass on their brain and not have immediate opportunity to discuss that with their physician, and waiting sometimes, in an order amount of time, it seems like days when you're waiting for your physician to call you about your report. And it's very difficult to do that in the course of a busy workday.
Yeah, I mean, that's something that I guess a lot of people are hoping for as well, for AI to give the ability to physicians to just interface with their patient or their general patient population at a much more, in a much more, I would say, like, intensive or integrated way. And I can't really wait for that, actually. So my last question is, what are the top 3 technological improvements that you believe would have the most impact for you at Community Health Physicians in 2024?
Well, I think, trying to really relieve the administrative burden on physicians. When there was a landmark study done by Dr. Sinsky at the AMA few years ago, and basically demonstrated that within 4 different specialties, for every hour you see a patient, you spend 2 hours doing administrative work. If we're going to provide increased access with the growing physician shortage and the number of baby boomers going on to Medicare and the number of people with chronic conditions, we will not be able to meet that need unless we flip that ratio. We can't be spending 2/3 of our time doing low-value work. So looking at things like I mentioned, how can we help physicians pre-visit plan in efficient ways? Can AI help us peruse the chart, identify what's happened in the interval since that last visit, summarize that, put that data into a format that it's easily accessible for that physician to see, so there's not hunting and gathering and retrieving information. I think that would be huge. That's one thing. Again, with ambient scribing now, I think that's going to be huge. There are already software tools and AI models out there. In fact, we're piloting one through Microsoft, DAX, and taking the whole documentation piece out of the equation. So it's done real time, so the physicians really can focus on the patient. That's really the other drawback to the electronic health record, has been the fact that physicians spend more time looking at their computer than they do with the patient, which is clearly unrewarding for both the physician and the patient. In fact, our exam rooms are so old that the way they're designed, our backs are to the patient most of the time because the tables are put into a corner because of the physical arrangement of the office. So you can't even look at the patient sometimes in these older offices because of the way that they're structured. So anything that can free up that human connection, because medicine is still a human enterprise, and we have to figure out how these tools augment that visit and not replace physicians, because patients really want that physical connection.
Wow, what an adventure. My concluding thoughts are that AI has a big role to play in healthcare this year. Implementing AI really well will provide the most impact out of anything. It was such a pleasure having you on the show. I'm looking forward to having you on for future episodes, Kevin.
Thank you very much for having me. It's been a pleasure, Sal.